private contractor with the Santara Health Systems here in Virginia. So, gentlemen, welcome to today's symposium. I said the word, and it's exciting to have all of you to be a part of this health awareness program. So I'm going to start off with Henry. Henry is going to tell us about the signs and symptoms of kidney diseases, especially the one that he is experiencing currently. So Henry, I'll hand over the mic to you. Thank you for being a part of this.
Okay. Thank you, Mike. Do you hear me?
We can hear you loud and clear.
Oh, okay. Thank you for having me. The reason why I want to talk about kidney problem, it's something that you don't have any symptoms. My problem started about 2 years ago. And I had a problem with gout. So I rushed to the hospital. And that's when they found out that I had kidney problems. And it was all the way down to 30%. My GFR was all the way down to 30%. So they referred me to a nephrologist, and I started doing the treatment, but it was way too late. And before I had this problem, I was doing my medical checks every year. And I don't know why the doctor didn't find out. I don't know if he didn't know the numbers. So what the most important thing I would say is, whenever you do your blood works, check for your GFR. That's your kidney function. Mine, I didn't have no symptoms. I was a regular person. I was doing everything normal. So the only time I found out was when I had the gout, and I went to the hospital, and they did the blood works, and I found out that my GFR was down to 30%. So I'll recommend that anyone who does the blood works always ask for the GFR. That's the function of the kidney and the percentage.
Thank you, Henry. So I'm trying to get a better understanding. So you meant to tell me you didn't experience any symptoms at all? So if it wasn't for the gout, you wouldn't have gone into the doctors?
That's correct. I didn't see any symptom. I was living like a regular person, doing whatever I can do.
Okay. All right. Very good. Okay. Now I'm going to have Dr. Boy to come in and talk to us about, how...
Good question for him.
Sure.
Did your doctor review after you had been diagnosed with a severe kidney disease? I mean, your previous kidney functions. Did your doctor review them with you?
No, he didn't. That time he wasn't still working. He transferred to a different site. But I took all my medical records to a different nephrologist.
Okay.
And what he told me was the decrease started 5 years ago.
5 years, okay.
So if the doctor found out that it was going down, 5 years ago it was like 60%. So they could have done something.
Sure. Okay.
Yeah. So
let me ask you a question. So at this point, what stage of kidney disease are you in? Are you end stage, or do you still tell us a bit more about where you are right now in terms of function?
Now I'm at end stage, so I'm doing dialysis.
Okay.
Yeah, so I have to do 3 times a week, 4 hours a session.
Gotcha.
And the reason why I want to do this is I want my brothers to know this so they don't go through what I'm going through.
Okay.
So the most important is, if you do your blood works, ask for the numbers, GFR, the percentage. That's where it's going to point to where your kidney function is.
Okay.
Because it's not easy going through this. You can't travel much. You are restricted. Your diet is restricted. Your work is restricted. Everything is restricted. So if I can save 1 person or 2, I'll be very happy.
Okay.
Thank you for that.
Just another question. Even though we're going to review these from the discussion, the panel we're going to be talking about, the nephrologist, the kidney doctor, did that person give you an idea as to why your kidney function got to where it is now?
Mine, they didn't know, but they did a kidney biopsy, but still they couldn't find what the cause is. But I'm on medication from diabetes and then blood pressure.
Blood pressure. Okay. Okay. Good. Good.
So that's what they suspected that caused the problem.
Most likely.
Okay.
Okay.
Okay, Henry.
Henry, and I have a last. Okay, go ahead. Go ahead.
How long have you had high blood pressure? How many years?
About 8 years. Both of them, the diabetes and the blood pressure, about 8 years.
About 8 years. Okay. 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 That's fine. Yeah, George, you can go.
Henry, I was going to ask you this question: that did they ever tell you that your blood pressure or your diabetes was not under control? Did you know your hemoglobin A1C?
Yeah, my A1C was 5.7.
It was so.
And then my blood pressure was mostly 145/90.
So I think they went ahead to do the kidney biopsy because they had some doubts that it was the diabetes or the hypertension that had caused your disease.
Yes.
Because typically, if you have diabetes and hypertension, we just stop at that and we won't go further to do kidney biopsy. So I think they were having some doubts as to whether something else was going on, right?
Yeah.
Right. That's fine. So we'll talk about all that.
Okay. And it will come up later on the discussion. You said your blood pressure has been around about what? 140. Give me the figures again.
145/90.
Okay. And do you think that is acceptable, that blood pressure?
My doctor said with the kidney problems, they should be around 130/80.
Yes. Okay. Yeah. Because what we always aim for is at least the barest minimum to have the top figure. The top figure we call systolic. You want to keep it below 140. Okay. That is the goal, to try to keep it below 140. And then the lower one, the diastolic, you want to always keep it below 90. So in general, you want to keep your blood pressure below 140/90. So anytime it stays around that area, or it goes beyond that, okay, 145, 190, it means that the control is not optimal. Okay, and this is where you could have damage to the kidney, not just damage to the kidney, it also high blood pressure causes damage to your brain, causes damage to your heart, okay, causes damage to your blood vessels, okay. In particular, combination of the blood pressure and diabetes, and most probably also even if you have high cholesterol, just like three things together.
Yes.
And if you smoke, just like four things combined together. Okay.
All right, we're already off to a great start.
Let me ask you a question.
Okay, go ahead.
Does drinking cause kidney problems?
You know what? I think why don't we go ahead and do the presentations, and then when it comes to questions,
I was just going to say that
all these are things we're going to address in our presentation.
Very good.
Okay, so let's go.
Okay.
All right. Thank you, Dr. Buffabonnet. Thank you, Dr. Boite. Now I'm going to hand over to Dr. Boite to present on what we call the pathogenesis of kidney diseases. Over to you, Dr. Boite.
Okay, good evening, everyone.
Good evening.
Just one quick point before I start my presentation. Just like what our dear brother talked to us, kidney disease, you may not feel any symptom. You may not feel any pain. You may not feel any discomfort. You may feel nothing until it is getting close to the end. And he mentioned that his kidney disease, he's at the very end stage. And we're going to go through the various stages at some point. But the key point that you always need to know is that at the very early stages of kidney disease, you may not have any symptom. You may not have any weakness. You may not have any swelling and so on, okay? So by the time you begin to feel a symptom related to kidney disease, it usually means that you are getting close to the end of the kidney disease. Okay, there are going to be two presentations, George and myself. We're going to go through that, and I'm going to wrap together some early aspects of the description of what kidneys are, what the disease itself is. And George will talk to us more in terms of how to manage chronic kidney, or how chronic kidney diseases are managed. At some point, there may be some bit of overlap between our presentations, and we have done that intentionally because some of the things that we're going to overlap are extremely important things. So that he will talk about, I'll talk about them, and then also he may also talk about them. It's a repetition, but it's a repetition to make sure that the point is driven into everyone. Okay, let me show over here my first slide. Is it over there for everyone to see?
Yes, sir.
Yes.
It's on.
Okay, so this is just for the general, the person who has, in terms of where the kidneys are located in our bodies. Okay, for we the medical personnel, this is what we do all the time. But these are the kidneys. Okay, if you can see over here, this is one. Yeah, every person has two. Some people may have only one as a result of an abnormality, but the normal, body type has these two kidneys that we can see over here. And there is a long tube that connects the kidneys from each side all the way down to the bladder over here, and then urine comes out. This is the general outline of what the kidneys are. And the second slide looks at what, before we get into what the kidney diseases are, you need to get an understanding as to what the kidneys do in our body. And there are multiple functions that kidneys can do. And the first one I got over there is that they remove waste products from our body. And when we talk about waste products, we're talking about if you eat any food, at the end of the food as you have eaten, the body absorbs what is essential to it. And then what is not required comes out when you go to the bathroom, when you go to toilet, okay, or you have a bowel movement, that is what comes out. But the portion that has been absorbed into the body, it is not everything that the body requires. Okay? It's going to go through a breakdown. The body remove the most important portion that it requires. And then what is left, it is the kidney that removes that waste product or excess product from the body. And same thing with excess fluids. If you drink fluid, you go drink beer, appetizer or whatever drink you take, your body doesn't require all that, doesn't need all that excess amount of fluid. And so what it does is the remaining amount that is not required, again, it is the kidneys that remove these fluids from our body. And the importance in knowing these things that if there is any problem with your kidney function, it means that you're not going to be able to remove these waste products. The excess fluids from your body are going to build up and cause problems to you. And then also, same thing with poisons. And when we talk about poisons, it could be anything. It could be chemical medication that you have taken. If you take blood pressure medicine, again, it's not every part of the blood pressure medicine that the body requires. There will be a portion of it that the body does not require. Again, that portion is what is going to be removed from the body by the kidneys. The next point is that that kidneys are also very important in helping us to control our normal blood pressure. What it means is that if there is a problem, again, with your kidneys, it means that you could end up having difficulty in terms of controlling your blood pressure. And our brother will probably attest to that. For those who have chronic kidney disease, sometimes they may require not just one blood pressure medicine to be able to control their blood pressure. Sometimes they require about 2, 3, or sometimes even 4 blood pressure medications for them to be able to get their their blood pressure properly controlled. This is all because of the damage that has occurred to the kidneys, which are important in terms of controlling the blood pressure. The kidneys also produce certain substances in our body we call hormones. These are hormones are substances that the body produces to help it to function properly. Red blood cells, which are produce the red part of the blood that we see, for it to be maintained properly, you require a properly functioning kidney properly functioning kidneys for this thing to occur. The kidneys are also important in terms of helping strengthen our bones. If there's a damage to your kidneys, your bones can end up becoming very weak. And again, our brother George will get into some details at some point for us in terms of how to manage these things. The next slide involves what we, in general, when doctors talk about kidney diseases, what they are referring to. We're basically referring to where there is a dysfunction. The kidneys are not functioning the way that they are supposed to do in terms of removing fluid, in terms of removing toxins, in terms of removing poisons from our body. Now, if this problem is something which has been going on for less than 3 months and gets back to normal, we doctors tend to refer to it as an acute kidney disease. But if this is a problem that has been ongoing and has gone on for more than 6 months, we refer to that as chronic kidney disease, And tonight's presentation is going to be more in terms of the chronic kidney disease, because this is the one that has been going on for more than 3 months. So this is our chronic kidney disease, basically damage which has gone on, as I said earlier on, for more than 3 months. And the way we are able to know that you have chronic kidney disease, in particular in the early stage, it's when you go see a doctor and then a blood test is done. Also, a urine test can also be done. That can also detect some abnormality. In particular, there are some substances in the body we call protein, and the kidneys help to regulate protein in your body. And if there's a damage to your kidneys, you could end up losing some of the protein through your urine. And this is something that doctors can do a urine test to detect. We can also do ultrasound that we can look at the size of the kidneys. And the radiologist reading the ultrasound based on the size of the kidney that you see, whether it is the normal size, whether it's a smaller size, or whether it's larger than the normal size. They can give us an idea as to how your kidneys are functioning or what kind of kidney problem you may have. And the last thing that our brother talked about, which he had, was kidney biopsy. And this is where the doctors will put a needle through your back to get into your kidneys, and then a small tissue is taken, and then it can be analyzed under the microscope to get an idea as to the extent of kidney damage or dysfunction that you have. And the stages of kidney disease, our brother talked about them. The stages are basically what are listed here. I don't want to confuse you. I got another slide which has all the details in terms of what GFR here and there. But the most important thing to know is that there are 5 stages. And the worst stage is stage 5. Okay? And the least in terms of dysfunction or in terms of damage is stage 1. And what usually tends to happen is that it tends to move from stage 1 up to stage 2, up to stage 3, 4, and 5. And this is what our brother emphasized to us, okay, that it's always important to discuss your blood test with your doctor. If your doctor calls you at the end of a blood test and tells you, George or Kofi, this is what I've seen as far as your kidney function or your GFR is concerned, please make sure that you take notation, make sure that you are aware of exactly what is going on. And in particular, get a follow-up in terms of year to year. Because if this particular year your kidney function is stage 2, you always want to make note of it to find out when you go talk to your doctor next time to find a doc, is it still at stage 1 or is it moving to stage 3? Because if it's increasing, because this may be the time for your doctor to get you referred to a specialist who can get an idea or an understanding as to exactly what is causing the kidney function for moving through those stages. So again, there are 5 stages, and stage 1 is the least, and stage 5 is the worst form of the chronic kidney disease. And those who are on dialysis are basically in the last stage, stage 5. And I've got a few figures in terms of the importance or how common chronic kidney disease is, the prevalence. Now, in the United States of America, the figure is approximately 15% of the adult population, adult US population, which basically means that that is 1 in 7. 1 in 7. Now, if you take the number of people who are on this forum now, who are watching this now, if there are 30 of us, okay, you can get an idea. We're talking about, it could mean that 3 or 4 of us may probably have chronic kidney disease. Okay, that is how common it is. 1 out of 7 of the adult population in the United States have chronic kidney disease. And in Ghana, the most recent study that they did that I got from 2019, last year, was around about 13.3%. You can look at it and you think it's, hey, it's probably a bit lower in Ghana than the United States. I don't know why it's lower in Ghana. It could be because in Ghana, as we all understand, people only show up to hospital for a test only when there is a problem. You don't get people going on a routine checkup if they do not have any high blood pressure or they are not feeling very well. That could understand why, that could explain why probably the figure in Ghana is probably being undercounted. Okay. But again, the key point is noting that 1 in 7 of the adult population in the United States have chronic kidney disease. Okay, now the risk factors for chronic kidney disease, the things that can give rise to chronic kidney disease, and our brother mentioned them. Okay, diabetes. It's probably number 1, and I'm fairly certain number 1, not in the United States, but a large part of the world. Diabetes is very common in terms of causing chronic kidney disease. And again, the importance in knowing these things, that means that if you have diabetes, you need to make sure that you follow every advice given to you by your doctor as far as controlling your diabetes is concerned. Okay? Because if it's not properly controlled over years, 4, 5, 6, 7, 10 years, you're going to end up having some damage to your kidney at some point. Okay? And there are some medications that sometimes doctors can give to patients to help sort of slow down the progression of any damage to the kidney from the diabetes. Okay? So again, important place, if you have diabetes, you need to make sure it's properly controlled. Next one is high blood pressure, hypertension. Okay. Again, if your blood pressure is not properly controlled, the figures that we always talk about is making sure that the top part of your blood pressure, the systolic, is less than 140. Okay. If you go and it's about 150, okay, and your doctor is not doing anything about it, okay, please remind the doctor, doc, my blood pressure is still not at the goal. And the goal is making sure that the top one is less than 140 and the bottom one is less than 90. Again, 140 over 90, that is where you want to keep your figures below those figures. Okay. And again, if your doctor is not helping to do that, remind the doctor to make adjustments in your blood pressure medication. And if an adjustment has been made, you please need to make sure that you are strict in terms of taking your blood pressure medication and then doing exactly things that will help keep it properly under control. And people with heart diseases, in particular those with congestive heart failure where their heart is fairly weak and is not able to pump blood properly around. Also, again, you could have damage to your kidneys as a result of that. Now, it also tends to run in families, chronic kidney disease, so that if your brother or sister, or if your parents tell you that they have chronic kidney disease, or if you know of someone in your family who is on dialysis or any such thing, it means that you need to pay particular attention, okay? It could be a genetic factor, or it could be because some of these diseases that we have talked about, diabetes and high blood pressure, you may have them, but your own has not been properly diagnosed. Okay? So please note about that it can also run through families. We know in people who are overweight, they tend also to get prone as a result of the overall problems relating to obesity, to getting chronic kidney disease. And there are several other situations in which people can also develop chronic kidney disease. We know of some herbal preparations, okay, that the people may take, in particular in developing countries. And some of these may end up, again, causing damage to your kidney that may become irreversible. There are also some specific diseases, such as lupus, okay? Lupus is a chronic disease that affects, fairly common in the United States, and it can cause damage to multiple organs in the body, and in particular the kidneys. Okay, and again, it's something that can be diagnosed and that can be treated. It cannot be cured completely, but lupus is a disease that, again, medication can help control and to help prevent damage to the kidneys from that. And these are things, again, I put this next slide there, not to frighten anyone, okay? But in terms of if you have chronic kidney disease, what can happen, okay? What it means is that if you have chronic kidney disease, okay, it can also get you prone to other diseases, okay? So you need to make sure that you see a doctor, get proper care, so that if you have chronic kidney disease, you don't end up with a stroke or heart disease. If you are not a proper care, at this stage, if your chronic kidney disease is fairly well advanced, you should be under the care of at least 2 doctors. That is your primary care doctor, and then also a kidney specialist. And the combination of the 2 doctors can help to make sure that you don't end up with a stroke or heart disease or severe forms of infections. Okay, if you have chronic kidney disease, we all know it. Okay, and these are facts. Again, unfortunately, people who have severe forms of chronic kidney disease, if they get infections such as this pandemic going on, this virus, okay, they tend to have more severe forms of the disease. So again, it's important to know all these things so that you take the proper precaution. Okay, life expectancy also tend to be reduced in people with chronic kidney disease. But again, it's important to make sure to know these things so that you can take appropriate measures, take good care of yourself, get your blood pressure properly controlled, get your diabetes properly controlled, take additional medications and so on that your doctor may prescribe to help control your disease. And this is the portion that is a bit of overlap between what I'm doing and what George is also going to be doing. These are the key things there in terms of diabetes, things that you need to do to make sure your diabetes is properly controlled, your heart disease, obesity, regular exercise, regular checkup, and so on. Again, George is going to go over a lot of these things in more detail than what I've basically done over here. That is the end of my presentation. And if there are any questions, or if the moderator thinks we should move on to the next stage, we can always go ahead and do that. Okay.
Yeah, Dr. Baite, so we'll wait till George's presentation is over, then we'll take questions. So okay. Audience, please hang tight. I'm now going to have Dr. Bafuboni do his presentation. Then afterwards, I'll open the floor for questions. Dr. Bibi, over to you, sir.
Okay, I was going to unmute myself, of course. You have to hear me. I'm trying to share my screen.
Dr. Bafuboni, can you speak up a bit?
Hold on a second. I'm trying to get my screen up.
Okay, sir.
And as soon as I'm done, I will speak to your hearing.
Thank you.
Okay, if you can't do it, call your daughter again.
You got it.
Oh boy, this time I'm all set. This time
it's there now, George.
See now? Okay, that's good. That's good. All right. So thanks for having me. By the way, Kofi, that was a great presentation.
Thank you.
For somebody like me, whom you taught biology in Form 3, Oh yeah, you should remember that.
I do remember. I
am not surprised at this level of.
When Rollins
did very well.
Medical School. Yeah.
Good. Okay, so we've heard about some insights into kidney problems. Okay, Dr. Boyton mentioned the prevalence, the causes, and the risk factors and other important information relating to kidney problems. That sets the stage for me to talk about the management. That's the approach we take when somebody has kidney disease. So let's dive right in. At the end of this discussion, it is hope that enough light will have been thrown on the most important studies that we do to detect kidney disease. Then we'll move ahead and talk about the approach you take once you develop established kidney problems. Then we'll discuss the options that are available to you once your kidney fails altogether. And we'll then conclude about giving a few tidbits on how to prevent kidney disease altogether. And at that point, I'll conclude and we'll take your questions. So, how is kidney disease detected? I think I'm going to skip through these couple of slides as Dr. Boite has already discussed them. He talked about albumin, blood tests and all that. So let me skip this one. He also talked about the 5 stages of kidney disease and the ultrasound and all that. Okay, so I'm going to talk about this slide just for the sake of reinforcement. Why do we need to know our labs at all? Do we need to know them? Is it necessary? Of course, it is. Apart from the fact that it helps us develop a course of action for treatment and then maybe monitor the response to treatment by tracking the numbers, it actually gives us ammunition of questions to ask our healthcare providers. As a patient, it is extremely important that you know what your lab values are, because if you are to ask any intelligent questions to your physicians or your healthcare providers, you should know what you're talking about. So you should be asking about your albumin. Do I have albumin in my urine? It is not supposed to be there. Why is it there? How long have I been having it? Have the levels been going up or coming down? So these are the questions that you should ask, and your doctor will see that you are more engaged in your medical care, and that will also put him on his toes. Okay. You also need to know what level your GFR is, because how you are managed as a kidney patient depends on what stage of kidney disease that you are in, and that's determined by your glomerular filtration rate. It gives an idea of how much kidney function you have left. Okay. So now let's talk about the steps to take in managing chronic kidney disease. You see, in chronic kidney disease, what happens is the functional units of the kidney become damaged over time. And when this happens, it becomes an irreversible process. There is nothing that we can do to bring the kidneys back. So the treatment is not aimed at a cure, but rather to prevent progression, further progression of the kidney disease. That's why we encourage the lifestyle changes, taking the necessary precautions that you have to take, and then using medications. And by medications, I don't mean medications that reverse the kidney damage. There is no such medication. Okay, but medications are important to the extent that they manage the risk factors that lead to kidney problems, and they also manage the complications that you develop as a result of your kidney problem. Okay, so what are some of the lifestyle changes? Something appears to have been cut from the slide. So what are some of the lifestyle changes that you should embark on as a kidney patient? You should stop smoking. And I think this one, nobody's going to argue with that. To the extent that tobacco causes hardening of your blood vessels, it can lead to almost any disease in the body, hypertension, heart disease, stroke, and all that. And the kidney, of course, is part of your body. So you can expect that it is not going to act well on your kidneys. So you definitely need to stop smoking. Tobacco doesn't have any business in the body. There is no function, there is no like an important function that you can ascribe to a nicotine in the body. Okay, all right. So we should also restrict our salt. I'll talk a little bit more about it later. We should balance our diets. And by that, we cannot forget about this place. Okay? You should balance our diets.
Daniel,
yeah, balance your diet. Great. Yes. So when it comes to eating a balanced diet, this is to present a visual cue. We stress on having a pyramid approach to balancing your diet. You realize that most of the diet will consist of grains, like pasta, rice, bread, and of course we can be a bit creative and add something like bangkung, kenke, jam, and all that. Okay, we can add it here. Okay, yes, and over here it also that's
talking about the goat.
Fufu, you forgot fufu.
I forgot that. Okay, so most of the diet is going to consist of that, but we should also eat a lot of fruits and vegetables. Okay, and over here too, we can add things like contemporary, and I think you're going to help me out here. Okay, so we should eat a lot of that. Then we should eat moderate protein and dairy products. And over here, it's just telling us that the amount of salt and sugar and fats and oil that we eat should be very little. So people should follow this pyramid model of eating to ensure that they've had balanced diet. And that goes a long way to improve your overall health and by extension, your kidneys. Okay. Now, I think Henry was going to ask a question about alcohol. Well, this is the thing. A drink or two every now and then is not going to hurt. It will not hurt. Just that you shouldn't drink too much. And by too much, what am I talking about? The CDC recommends that we shouldn't have 2 drinks per day. That's for a man. For a female, no more than 1 drink per day. Okay. So what constitutes a drink? What is this thing doing? So what constitutes a drink? I have this chart that gives the equivalences between the various forms of alcohol that we have. So if you drink 2 beers in a day, that's it. Don't go beyond that. Okay. And I say this because alcohol doubles your chances of progressing to end-stage renal disease once you have established kidney disease. Heavy drinking can cause that. And if you smoke in addition to drinking alcohol, then your risk is increased 5 times. So it's with a great importance that we need to attach to stopping drinking. Okay. You should also lose weight, targeting for a BMI between 18 to 25. Okay. All right. That also improves your overall health. And I also want to talk about increasing physical activity. It is recommended that you exercise or increase your activity at least for 30 minutes for most days of the week. So maybe for 4 to 5 days, every day you increase your activity and to ensure that you are living healthy. It is very difficult to do, but we have some people amongst us that have done it very, very well. So maybe at a point they can come and tell us how they've been doing it so effectively.
Bob.
Yes. Great. Okay. So yes, we also need to do some dietary modifications once we develop established kidney disease. And the point here is that this is an organ that's struggling to get rid of the waste products and the salts and all that. Then we are going to add more by way of eating the food that's going to generate them. So the wisdom underlying this is that we should cut back on certain things. If you talk about salt, the total amount of salt that you eat for all your meals should fit onto a teaspoon. It should be more. It should not be more than 2.4 grams. Why did I write 2.5? It's 2.4. So it should not be more than 2.5 grams per day. Okay, because your eating too much salt can affect your blood pressure, which can also further damage your kidneys. Okay. If food is to last long on a shelf, that means some preservatives have been added to it, which contains so much salt. Okay, so eating processed food is something that we have to be very, very careful about. We should decrease it. If you are somebody who eats it every day, maybe you can cut it down to about once or twice a week. But you should be aware that it contains phosphorus and potassium and sodium and all that, which is not good for the kidneys. The kidney cannot get rid of potassium and phosphorus that much. So we need to cut back on the types of food that generate them. And I don't want to use the word protein restriction. We're a bit concerned about protein in the sense that it generates something called urea by way of its metabolism, which the kidneys cannot get rid of. And so we tend to say that you should limit your protein, but I don't want to use the word a limit. Just eat the right amount of protein. Eat some protein to build your immunity and make you healthy, but don't eat too much. Don't like you've gone to the chop bar and you have a lot of meat on your food. You can't even see your fufu and all that. Those days are gone. Okay, so and another thing I would want to point out is the controversy behind drinking water when it comes to kidney failure. There is no hard and fast rule that you should not drink or you should drink more. Just drink according to your test. Unless you have conditions like kidney stones where we tell you to drink between 2.5 to 3 liters of fluid in a day, you should not actually impose any limitations. Just drink according to your test. Okay. However, if the kidney dysfunction progresses to the point where you've developed swelling, then there will be some fluid restriction. Or when you develop end-stage renal disease, then there will be fluid restriction. Okay, so there's something that we should take note of. You should also know the things that may harm you. So that you take the necessary precautions. There are certain agents that we use with CAT scans, which can be harmful to the kidneys. They are called IV contrast agents. Okay, so let's say that you find yourself in the emergency room one day and there is this doctor that doesn't know you and orders a CAT scan. It is critically important that you be an advocate for yourself. You are the one required to tell the doctor that I have a kidney problem. Okay, because he cannot look at you and tell that you have it. Kidney disease, for the most part, about 97% of patients that have it, they don't exhibit any signs at all. So it is the onus of telling the doctor that you have a kidney problem rests with you. And as soon as you tell him that I have a kidney problem, he knows what to do. Okay, so let's take note of that. And now painkillers, painkillers, painkillers. You see all these medications here. They are called non-steroidal anti-inflammatory agents. These medications were never designed to be taken on a long-term basis. You have pain, then you take it for maybe a couple of days and you stop. You shouldn't be using it on a chronic basis at all. We tend to recommend Tylenol for pain. If you realize that you have to require more than that, you seek help. Okay, so you have to be very careful about pain medications. Also, if your colonoscopy preparation agent contains phosphorus, you can just discard it. You should not take phosphorus containing colonoscopy prep agents ever. Never ever take that. Okay. So it's generally recommended that before you start any new medication or even herbal medication, you should consult your healthcare agent or your pharmacist to help you know whether that is something that you can take or not. Okay. All right. Now we come to medications. And like I told you, medications cannot reverse the kidney damage. There is no medication that can do that. But to the extent that it treats the risk factors that causes the kidney problem and also treats the complications, they are important in the management of kidney disease. So we're going to talk about this a bit. So in terms of risk factors, right, it's mainly diabetes and hypertension. The two most important causes of chronic kidney disease are diabetes and hypertension. The story of kidney disease is the story of diabetes and hypertension. Beyond these two, there is a mixed bag of things that cause it, and that Akatakyie enumerated them all when he was talking. So when you are managing your diabetes, you aim for a fasting blood sugar between 90 and 130. And fasting blood sugar is the blood sugar that you check on an empty stomach, typically before your first meal. Okay, it should be between 90 and 130. And the blood sugar should be less than 180 if it's been 2 hours since your last meal. Okay, that's the non-fasting blood sugar. And as a diabetic, you should know your hemoglobin A1C. There's a very important number that you should know, hemoglobin A1C. It tells us how well your diabetes has been controlled over time. Okay, you want it around, say, 7. Okay, you want it around 7, 7.5. It's okay, but you don't want it anywhere around 8.5, 9, and thereabouts. That's very bad. So all the management of your diabetes that you are doing to get a hemoglobin A1C around 7. And the same goes for hypertension, which Dr. Boyd talked about. You should aim for a blood pressure of 149, 90. Work with your doctor to get you at this level. But if as a hypertensive, you also have diabetes or you have protein in your urine, then we advocate for even a stricter control. It should be around 130, 80. So you should be very, very careful about this. And it's always a good idea to have a log of your blood pressure measurements, so your physician reviews it when you go to the clinic. Okay. And a heart disease can also cause kidney problems. Kidney problems can also cause heart disease, like like the chicken or the egg. Okay, so it's important to make sure that your heart is in good health. And in addition to controlling your high blood pressure and your diabetes and other problems, you need to check your cholesterol. Your cholesterol needs to be in check. This is the bad cholesterol, the LDL. You always want it to be below 100. As a as a patient with a chronic kidney disease. This is different from someone without kidney disease. Okay, but once you have kidney disease, it should be below 100. The good cholesterol, you always want it to be high. Okay. Now, we're going to talk about the complications of having kidney problems. You see, like Dr. Boite was talking about, in addition to the waste products that the kidneys get rid of, it produces hormones. Okay? There is a hormone called erythropoietin, which instructs the bone marrow to produce blood. Okay? So when the kidney is out of whack, of course, you are not going to be producing this. So we give you a synthetic form when your blood count is low, especially when we make sure that nothing else is causing you to have the anemia. Okay? The same goes for bone disease. Because the kidney produces the hormone, the active form of vitamin D, its dysfunction is going to impair with this hormone production. And therefore, there will be abnormalities in your calcium regulation, which will lead to bone problems. So we treat this with calcium and we replace vitamin D. Because your kidney is not filtering out properly, you tend to develop excess acid in your body, which we treat with bicarbonate. And then excess salts like potassium and phosphorus can also build, which we also treat with binders, which you take to bind it in your stomach or your gut before it gets the chance to be absorbed into your body. Okay, and then I'm going to talk about a little bit about diuretics. These are medications that we use to treat fluid buildup. And fluid buildup typically starts as ankle swelling. It starts as ankle swelling, or maybe swelling behind your eyelids. Okay, so when you have ankle swelling, it's typically a cosmetic problem. You can put on some stockings and take some diuretics or fluid pills, and you're on your way. But as the kidney dysfunction progresses, the swelling comes to involve more parts of your body. If it gets to your chest cavity, you collect fluid in your chest cavity and your lungs, then you develop shortness of breath. And at that point, you're admitted to the hospital to get the intravenous form of these diuretics I'm talking about. So what have we been saying so far? Managing chronic kidney disease is not just doing one thing. It is a multifaceted approach. It is an overall plan of care, okay, with appropriate lifestyle changes and aggressively controlling your risk factors. You can work with your physicians and your healthcare team to prevent further loss of your kidney function. Okay. All right. Now, let's talk about when the kidneys fail altogether. So at this stage, the kidneys do not filter enough to maintain the normal functioning of your body. This is the time when your glomerular filtration rates, your GFR, like Henry was talking about, would have dropped to as low as maybe 15. Okay. You tend to build a lot of waste products in your body. Acids collect. You probably would have had a couple of admissions to the hospital for shortness of breath because fluid has built up so much that it's accumulated in your chest cavity. When we see signs like this, that means that the kidney is at the end of its life and it needs to be replaced artificially. And that's where we talk about dialysis and kidney transplantation. See, kidney transplantation obviously is the best, but because it is so scarce to get, most people do dialysis as a bridge to this end. Okay. And we'll talk about them individually. Okay. We have two types of dialysis, hemodialysis and peritoneal dialysis, which I'm going to talk about. So hemodialysis, I pulled the schematic of the web. This is the basic mechanism of the dialysis. Hemodialysis is a kind of dialysis that happens outside the body. Okay. Here, blood is taken from the patient and it courses through a machine called a dialyzer. This is the artificial kidney itself. And over here, excess fluid is removed. The salts are balanced, and the toxins or the waste products are removed. Okay. Then the cleansed blood is made to circulate back into your body, and the process repeats itself continuously to the point where the blood is adequately cleansed. Okay, so this is done about 3 times per week, Monday, Wednesday, Friday, or the alternate days, and each session lasts for about 4 hours. Okay, it typically requires an access to blood, which I'll talk about. And although it's done at the center, you can be trained to do it at home. Okay. So this to show you what the dialysis machine looks like. And this is a typical hemodialysis center in the United States. Okay. So I was talking about dialysis access. These are the various types. And there's the central venous catheter, which is a specialized catheter which causes under the skin to insert into a major vessel. You see, as soon as this is placed, it can be used right away. So we typically use it for acute dialysis, but it could also be given for used for chronic dialysis. The downside of this, though, is that it is prone to infections, making these two the more preferred modes of access. This is AV fistula, arteriovenous fistula. Fistula means connection. So over here, what happens is there is a surgical connection, or a connection is made between the artery and the vein. And so what's going to happen is that arterial blood gets into the vein directly. And in the course of that, it causes the veins to become bigger over time. So they become bigger, bigger, bigger until such a time that it becomes very easy to put a needle into it. At this stage, we say that the fistula is mature. This process takes about 6 weeks, about 6 weeks to 2 months. Okay, so it is not a form of access that you would use when you need to start dialysis immediately. Okay. And this is AV grafts, arteriovenous grafts. There is also a connection between the artery and the vein, but is by way of a connecting tube called a graft. Okay, so what happens is a needle can be stuck directly into the tube, and we don't have to wait for the veins to get big before we start using. So this can be ready to be used in a relatively shorter time than the AV fistula. So that was just by way of showing you how dialysis accesses are made. Okay. Now we come to peritoneal dialysis. You see the other form was hemodialysis. Now this is peritoneal dialysis, and it's a form of dialysis that occurs inside the body. And over here, it takes advantage of the thin layer of tissue that lines the abdominal cavity, called the peritoneum. Okay. The abdominal cavity itself is called the peritoneal cavity. So what happens here is that a special fluid is made to dwell inside the abdominal cavity by way of a surgically inserted tube, okay? And by the process of osmosis, if you don't remember what osmosis is, ask my brother in Chicago, he will take you through the process of osmosis.
Tobacco.
Yes, tobacco, you got it. Yes, he will take you through the process of osmosis. So by the process of osmosis, what happens is the poisons in the blood is sucked into the fluid. The poisons, the extra fluid that you have in your body because the kidney is not working properly, all of it is sucked. Also, the salts are sucked into this fluid. And after it's dwelled for some time, is drained into a bag, and the process is repeated. Okay, so people find this to be a bit more convenient because it is usually done at home, and you can even do it at work. All right. So there are two types of peritoneal dialysis: the continuous ambulatory peritoneal dialysis, where the patient controls everything. And the good thing about it is that it doesn't require any machines or any special equipment. And there is another one, a programmable one, where you set up before you go to bed, and the machine does everything for you, the filling, the draining, and all that. Okay. So over here, you can see that Masa is trying to set his machine up before going to bed. Okay. And he's wearing a mask. He's not wearing it for COVID. He's just trying to maintain a hygienic environment so he doesn't contaminate his PD catheter. So, and this is just to show you how the peritoneal dialysis catheter is. Okay? All right. Now we come to kidney transplantation. Okay. This is the ultimate management for kidney failure. It is not a cure. That's one thing that we have to understand. Kidney transplantation is not a cure. It is a treatment because you will still be taking medications. Okay, so over here, what happens is that the kidney from another person, it could be the kidney from a living person, an aunt, a daughter, a friend, whoever, okay, or a diseased donor. Okay? So the kidney is implanted at the lower part of the abdomen into your vessels and in the bladder. Okay? The original kidneys are left in place unless there is a compelling reason to take them out. So as a kidney transplant patient, the urine that you produce is coming from both your transplanted kidney and your native kidneys, especially if you were making a lot of pee before the transplantation. So obviously, transplant is the best treatment because in addition to improving your longevity, it also improves your quality of life. It improves your quality of life. Most people can return to work if they have the transplant. The downside, though, is that because the body sees the kidney as a foreign object, the immune system tries to reject it. And to offset that, we give medications to dampen the immune system called anti-rejection medications. Okay, so with your immune systems dampened, you become very prone to infections. Okay, so that is the downside of it. And also, along with the numerous advantages that come with transplant, also comes the requirement for you to be responsible for your disease. You should be following up with your transplant coordinators. You can't miss clinic appointments. You cannot miss your medications. You should be very, very compliant and responsible. Okay. So who do we give a kidney to? People with, you don't have to be in top-notch shape to get it. No, that is not the requirement, but your overall health status should be reasonably good. Okay. You should also have a reasonable life expectancy. You should have good social and family support. If you need help, you should be able to get it. Okay. And of course, you will have made up your mind to get a kidney, and you should be willing to adhere to this long-term medical commitment that is required of you as a kidney transplant patient. Who can we not give a kidney to? If you have cancer and you receive a kidney transplant, the cancer can get worse. The same goes for severe infections. So these people are screened out. And we also need to make sure that once you get a kidney, you are going to be taking the medications appropriately to prevent any rejection. Because let's say that if somebody has donated his or a kidney to you, you don't take good care of it, within the next week, you reject it. That means that he has donated it for nothing. And there's something that we want to prevent. So if you have a psychiatric problem that is not treated, you will not be a candidate for kidney transplantation. And of course, I'm not going to have any argument about alcohol and drug addiction. Okay. Also, if you have any other serious medical problems like severe heart disease, severe emphysema, and any other severe medical problems that decrease your life expectancy, you will not be a candidate. Okay. And the caveat that it is important to know that advanced age alone cannot disqualify you. Other things are taken into consideration. Okay. This is just to show you what a typical transplant team looks like. You will meet all these kind of subspecialties who make sure that your kidney is working well. Okay. And let me end by saying a word or two about how to prevent kidney disease altogether. And we're talking about somebody without kidney problems at all. Okay, how to prevent kidney disease. Most of these we've talked about. It's important to manage any comorbid condition that you have, because the kidney is part of the body. And if an organ is not doing well, don't think it is that organ alone that's in trouble. The kidney can eventually get into trouble too. So you should manage all comorbidity, but especially diabetes and hypertension. You should manage it very, very well. You should make healthy food choices, like we talked about. Make sure that your food is basically unprocessed food and plant-based, so that you don't have much cholesterol. If you have to work with a dietitian to control your weight, hey, so be it. Okay, and we talked about exercise. We talked about smoking and alcohol. It is also important that you get enough sleep. Recent studies coming out have linked a lack of sleep to progression of kidney diseases. No definite association, no definite causation has been made, but there's been some form of association of that. So it's important that you get enough sleep. And the importance of following regularly with your healthcare agent cannot be overemphasized. You need to be following up, asking the appropriate questions about your blood pressure, your A1C, the important things that you need to know about. So I will conclude here and take your questions, and thanks for your attention.
Thank you, Dr. Bafuboni. So folks, I'm going to open the floor for questions, but I'm going to first start by reading the ones in the chat room. And Dr. Bafuboni and Dr. Boite, thank you so much for your time and your extensive knowledge and insight about kidney diseases. Could you please do me a favor and forward the presentations to Mr. Ajay Digor, so that he can post it on the Akatakyie DMV platform, please.
Okay, we'll do so.
Thank you.
Absolutely.
Okay, so I'm going to go to the chat box and ask the questions listed in the chat box. Then afterwards, I will let folks get on the mic and ask their questions. Okay, the first question is from Mr. Gigal, Mr. Dominic. What is the status of a stroke survivor, i.e., does he automatically have cardiac disease, I believe he's asking? Or chronic kidney disease, sorry. So the question is, what is the status of a stroke survivor, i.e., does he automatically have a kidney disease, a chronic kidney disease?
Okay, I'll take that.
Okay, sure. Take
okay. Now, the fact that someone has had a stroke doesn't mean the person is automatically going to get chronic kidney disease. No, it is not the stroke per se that is going to lead to chronic kidney disease. But what we know is that some of the things that give rise to a stroke, such as diabetes, high blood pressure, high cholesterol, smoking, these are things that can also cause a damage to the kidney. So anyone who has had a stroke needs to have these appropriate checkup made to make sure that if there's any diabetes, diabetes is properly controlled, high blood pressure controlled, and all the key things that George talked about are properly controlled. It is not the stroke itself, the fact that you had a stroke, that doesn't mean you're going to get chronic kidney disease now. But the factors that led to the stroke need to be properly controlled, because invariably all those same factors can also give rise to chronic kidney disease.
Thank you. Mr. Dominic, Akatakyie Dominic, I hope your question is answered. Okay, the next question comes from Akatakyie Jojo. How can one protect kidneys if one takes medication to protect a health condition? I can repeat the question again. He goes, how can one protect his kidneys or her kidneys if one takes medicine, probably for another condition?
All right, so I'll take this one. It depends on the medication in question here. It's important that you know the medications that are harmful to your kidneys, like I talked about, the non-steroidal anti-inflammatory medications, the pain medications that we have over the counter. The fact that they are over the counter doesn't make them safe medications for your kidneys. So do not ever take pain medications like Ali, Motrin, and those other kind of non-steroidals if you have been diagnosed as having kidney disease. Okay, and I don't know if that was what your question was trying to get me to address, but yeah, and also there are some medications that you take that are beneficial for the kidneys in a sense. Let's say that you have diabetes and you have started spilling protein in your urine, and you have to be on a blood pressure medication. There is a special kind of medicine that we give you called ACE inhibitors, which in addition to treating your hypertension will prevent the protein that you are spilling into your kidneys. So in that sense, that medication will be protective to the kidneys too. So that's all I have to say.
All right, thank you. The next question is from Akatakyie Gigal again. So he wants to know that, he says, I thought taking fruits are healthy for your body. So why are we saying that too much fruits can lead to chronic kidney disease?
Well, we did not say that. And I can reproduce the food pyramid that I indicated. Like, you should, most of the diet that you eat is going to contain carbohydrates. That will form the bulk of what you eat. But you should eat a lot of fruits too. You should eat a lot of fruits and vegetables. It's very, very important. What you should not be eating is oils and refined sugars, and you should not be eating too much protein, okay? But fruits, you should definitely go ahead and eat them. But you have to be very careful though. Some of the fruits like grapes,
Yes.
right?
Mhm.
Some of the fruits like grapes, in addition to being fruit, also contain very high amount of refined sugar. So those ones you have to be very careful about. Those ones you have to be very careful about. But you eat fruits and green leafy vegetables combined in general.
Yeah, let me
Okay.
add to that.
Thank you.
Eating fruits, it's always good all the time, okay? The point that George is making is that continue eating fruits. But if you have chronic kidney disease, in particular, those whose chronic kidney diseases are around about stage 4 or stage 5, this is where it's getting to the severe form of chronic kidney disease. Now, at those level of at that level of kidney dysfunction, the kidneys are not good in terms of removing some of the byproducts from eating fruits. In particular, if you eat a lot of banana, in particular, if you have chronic kidney disease, it contains a lot of potassium. The kidneys, when they are severely damaged, are not good at removing potassium from the body. So your potassium level is likely to go up if you're eating a lot of these. But for the average person or someone even who has chronic kidney disease and it's at the early stage or the middle stage, continue eating the fruits because they are very helpful indeed. Don't stop taking them. And always discuss these things based on the level of your kidney dysfunction with your kidney specialist. They will be able to let you know the particular type of fruits to avoid that will contain some of these substances that the kidneys are not able to handle properly. But please, the general advice, continue eating fruits, okay, until if you have chronic kidney disease, it's getting to the end stage, and then discuss with your doctor as to whether you need to continue eating them or to stop them.
Okay. Thank you, Dr. Boite. Akatakyie Giga also have another question. He wants to know if he says if his blood sugar is in the mid 200, what should be done to control it?
Okay, mid 200, that is way on the high side. Again, diabetes control involves multiple factors. Number one, the diet, the kind of food that you're eating. Okay, make sure that if you are not on the appropriate diet as far as your diabetes is concerned, make sure you see a dietitian, especially that will be able to guide you in terms of what proportions of your meal, how to eat, whether to eat what is small meals, how often you need to eat. The dietitian will be able to help you in terms of that. So the amount to eat, the quantity to eat, and then how often you need to eat. Okay, that's very important in terms of that. So that is diet. And then also diabetes control involves exercise. Okay, exercise. When we talk about exercise, it doesn't mean you need to go run marathon. Now we're talking about may involve simple walking around. Okay, you can walk around 30 minutes, walk around half a mile each day, or 3-4 times a day. Is very helpful indeed in terms of maintaining a good lifestyle. Okay, so diet, exercise. If you're overweight, you need to make sure that that is dealt with so that there is appropriate weight reduction and to help control the diabetes. And the last factor is in terms of medication. So again, if your blood sugar is in the 200s, you need to address all these factors that we talked about. I talked about. Now, if after addressing these factors, your blood sugar is so high, then your doctor will need to adjust the medication that you're on. You may be on tablets, and you may have gotten to the point where the tablets are not adequate in terms of controlling your blood sugar. Your doctor may opt to start you on insulin injection to help get your blood sugar properly controlled. But please, if your blood sugar is in the 200s, please, you need to make sure that your doctor pays attention to it. And not just your doctor, but you pay attention to it, because those are the things that will eventually, it's not a question of whether they will eventually give rise to chronic kidney disease if the blood sugar has been staying in those high figures. I don't know.
Thank you, Dr. Baite. Okay, the next question is from Akatakyie Digo. He wants you to explain how having gout can lead to kidney disease, as Henry stated.
Okay.
All right. So
yeah, go ahead, George.
Okay.
All right. So gout can lead to kidney disease by virtue of the fact that some crystals of the gout can form in the kidneys. Okay. There is a substance called uric acid, which when it builds up in you, as gout patients typically get, it can form deposits in your kidneys and form kidney stones. At times, even before they get to form the kidney stones, they deposit in the fine tubules that make the urine themselves and cause some abnormalities there. So gout is something that you would want to control a lot, okay? There is a figure that we typically would want you to keep your uric acid level at, especially when the gout has appeared on your skin. We call it tophaceous gout, okay? You want to keep your uric acid level to below 6 when you have gout that has involved your skin and all that, okay? And it can also cause you to have kidney dysfunction. And this is where we talk about modifying the acidity of your urine such that it will prevent the crystals from forming in there. Okay, so the long and short of it is that the control of gout should be extremely, you should control it to the point where you don't build too much uric acid in your blood. The fact that you are not having pain does not mean you should not be taking your gout medications. Your uric acid will still be high to the point where you can develop the kidney problems. Okay.
All right, thank you. The next question from the chat room comes from Akatakyie Augustine. He wants to know what the effect of belly fat has on your kidneys.
Okay. It's basically belly fat.
Not talking as well.
Yeah, means you are overweight. And we already mentioned that obesity is one of the things that, if it's not dealt with, can give rise to and damage your kidneys or predispose to that. And it's usually not just the belly fat itself. Okay? The fact that you have belly fat means that you're going to get prone to developmental diseases. Okay, if you're overweight, your chances of developing diabetes is a bit on the high side, in particular if diabetes is in your family. Okay, if you're overweight, blood pressure issues become important. Okay, so the obesity or the belly fat itself can give rise to these conditions, which can end up causing damage to your kidneys. Okay, but please, belly fat is not good. You need to address it. It's not easy addressing it, but you need to find a way to overcome overweight.
And I'm going to add to that. And I'm going to add to that. So belly fat, and of course, should not be.
Look at the pot calling the kettle black.
Yeah. So long as you can't see me from below, that's fine.
Yeah, they're often just pointing back at you.
But belly fat distribution is very important. Okay. So it is not just belly fat that's causing your kidney dysfunction. The fact that the fat is distributed there is indicative of something else going on, right? We have something called syndrome X. Okay, there is something called syndrome X. It is a condition where you have a combination of hypertension, diabetes, high cholesterol, and fat deposition in your body. This fat deposition tends to dwell in your abdominal portion, your belly. Okay, so it is part of a problem. It is not there just in isolation. It is part of a whole syndrome. So if somebody has belly fat and has very difficult to control diabetes, has high blood pressure and all that, there is a likelihood of developing kidney disease. Okay, so it is all these things combined that has caused the kidney disease and not just the belly fat.
Okay.
That's how
Thank you, Dr. Bafuboni. So the next question in the chat room comes from Akatakyie Crenshaw. I believe this is Pogasio. Pogas, welcome to the platform. So he wants to know if somebody can be born naturally with 3 kidneys.
No,
I haven't seen that.
What he means by natural. Okay.
He said the person had 3 kidneys at birth.
Yeah, that is an abnormality. Okay, that is not normal. What it basically means is that in the development of that person or that child in the mother's womb, something went wrong, so that one of the kidneys, instead of developing as a single kidney, end up being split or something else developing there. But that is not normal. Normal person, you have 2 kidneys and not 3. Normal person is not just a single kidney and 2 kidneys, 2 normal functioning kidneys. The presence of a 3rd kidney means there is something wrong, and your doctor will need to do the appropriate test to find out what the kidneys, what other associated conditions are there causing the 3rd kidney to be present. But that is not normal. That is.
All right, thank you, sir. All right, the next question comes from Akatakyie John. I believe this is Dr. John Amo. John wants to know what type of fruits and vegetables are good for cleansing the kidneys.
Oh, do you want to take it?
Well, I guess I just want to address the cleansing. Okay. I don't know anything like cleansing. Like we have a lot of there is a lot of commercials going on about things that can cleanse your colon, your abdomen, and all that. Like the thing is, what are you cleansing? There is nothing to be cleansed. If you have kidney stones, that needs to be flushed away. Of course, we give you a set amount of water that you have to drink every day, the minimum amount of water that you have to drink every day, and you are given some other things, but we don't have anything that cleanses something because there is nothing to be cleansed. But fruits on the whole, like we've said, are very, very good, except when you get to the terminal stages of the kidney life where you have to be very careful about fruits containing potassium and phosphorus and all that. So fruits in general are good. They are good for you, even if you do not have kidney problems. Okay.
Thank you, Dr. Bafuboni. The next question comes from Akatakyie William Blagoji. He wants to know, does type 2 diabetes have a similar impact on your kidneys? And then I'll let you answer that first. He has a second question, so I'll ask that after the answer comes.
Can I go?
Oh yeah, go ahead.
Yeah, sure. Type 2 diabetes, as a matter of fact, a lot of the patients with kidney problems have type 2 diabetes. Type 1 diabetes can also cause, but it is not as much as type 2. Most of the patients on the dialysis and on the kidney transplant lists, most of them are type 2 diabetics. So it is very, very important to manage that appropriately. In most cases, type 1 diabetes, you don't have much control over its causation. You may have developed a viral infection, and it may have damaged your pancreas, and then you develop this type 1 diabetes. But for type 2 diabetes, things like obesity and lifestyle play a lot in its causation. So it's important that you control the type 2 diabetes to prevent any downstream problems.
Okay. Okay. So Akatakyie Blagoji has a 4-part question. So I'm going to ask the second one for him. So he wants to know the reasoning behind using phosphorus for colonoscopy if it has a tendency to damage your kidneys. Why is it even recommended?
The phosphorus itself, it is part of the preparation. If you don't have kidney problems, it is not a problem at all. If you don't have kidney problems, if a normal kidney can handle any salt that gets into your body, a normal kidney, it can handle salts as much as possible. Of course, not in the extremes. Okay, so it is not like, oh, we shouldn't use phosphorus in kidney cleansing agents at all. It is just there as part of the preparation. Most of it is not absorbed. It goes through the gut. But when you have kidney problems and you have a problem with excreting your phosphorus, then of course you don't want to risk and add any more phosphorus to its workload. That's why we recommend against it, but it's only when you have kidney problems. A lot of patients use phosphate-based cleansing agents and they are fine.
Yeah, let me add some a little bit. When we talked about the functions of the kidneys, we mentioned removing fluid, and what George also talked about is also removing some byproduct or certain substances such as phosphorus and potassium from the body. And for those who have chronic kidney disease, in particular severe forms of chronic kidney disease, the kidneys are not able to remove these substances, potassium and phosphorus, from the body properly. And this is why we don't want you taking excess potassium or taking excess phosphorus. So you're given medications that can help the body remove these excess substances from the body. So that is the reason why you don't want to go ahead and then use anything that contains phosphorus to add to the problem that you're already having.
All right, thank you so much, sir. Okay, Akatakyie Blagoji's next question, it goes like this. He said the schematic that you showed for the kidney transplant, Dr. Bibi, he says that it was placed at a different location than the original location. And so I think he wants to know why that was the case.
So let me see if I can go back to the diagram here. Hey, where is it? There you go.
Right there.
Yes, so it was placed, oh boy.
Mike,
So they did, oh my goodness, what is this? Okay,
Where
good. So the question is, why didn't they place it? So the question is, why didn't they place it at the original location?
Right.
Okay, so this is the thing. It takes a lot. It takes a lot of surgery to remove both kidneys, okay? And a lot of studies have indicated that they do better when the kidneys are not removed. The kidneys are kept in place. Unless you have a very big kidney, like they have in polycystic kidney disease, where your kidney can become so big, like to simulate pregnancy. Under those circumstances, the kidney is taken out. But they are left in place because the studies have shown us that the patients do better with them being in place. So the only other place available to put it is inside the abdominal cavity at a lower portion, where it will be maximally protected. It will not be compressed, and it can function effectively.
All right.
Thank
you.
Let me add, the additional reason also is even though the kidneys are damaged, okay, and you're going to require transplant, those two kidneys that have already been damaged, they are still producing some substances that are helping the body in terms of controlling your blood pressure, in terms of controlling your red blood cell level, in terms of managing your electrolytes or maintaining the strength of your bones. Okay. Now, those functions are not down to zero. They are reduced, but they are still there. So you're getting some form of benefit from those kidneys. So they leave them behind, and then you get this additional kidney that will help in terms of removing toxins, in terms of removing extra fluid from your body. Okay, so it's always, and it does happen in some people in which the transplanted kidney is rejected by the body, and when that rejection takes place, the kidneys that were left behind are still there to produce minimal amount of hormones or other substances to help maintain the function of your kidneys, your bones. So if during the transplant they removed the two kidneys, now the one that has been transplanted is not working, it basically means there's no kidney left behind. And there's nothing there to produce some of the substances, even though in smaller amounts, that your body still requires.
Thank you, Senior Baite. Okay, Akatakyie Blagoji's last question. He wants to know the linkage between kidney disease and incontinence.
Between what? Kidney disease and
incontinence.
Incontinence. Oh, okay, okay. Now it's not the kidney disease itself, okay, that is going to give rise to urinary incontinence. Okay, when he talked about urinary incontinence, we basically referring to situations in which you sort of lose control over your urine. Okay, you feel like passing urine, and if you don't pass it right away, the urine ends up sometimes dribbling around. Sometimes it comes out at time that you have no control, or you don't expect the urine to flow out. Okay. Now, again, it is not the chronic kidney disease itself that gives rise to that. Sometimes it is the cause of the chronic kidney disease that may be causing that. Okay. And very, very common example is diseases of the prostate. Okay. If you have very enlarged prostate. Now, if you're looking at the diagram that George has over there, where you have the two kidneys, and there are some tubes linking the two kidneys all the way down to the bladder. Okay. Now, below the bladder, this is a tube. This is where the urine passes and goes outside. Now, at the bottom where he's put the arrow, that is where the prostate gland is located. So if your prostate is enlarged, it presses on that tiny tube. So the urine is not able to flow out and get out properly. You're not able to pass the urine properly. And because you're not able to pass the urine out properly, it builds up and stays inside your bladder. So there's pooling of urine inside the bladder. And because there's pooling of urine inside the bladder, it flows all the way back. The urine goes all the way back because it's not going out, and it causes damage to the kidneys. So prostate problems that are not properly handled can cause damage to your kidneys. And if you have this kind of situation developing, and again, this is a very common enlarged prostate. Many of us who are on this forum probably may have some form of enlarged prostate. And it is this enlarged prostate which is causing the damage to the kidney, and this same enlarged prostate which is giving you the urinary problem that you're talking about, the urinary incontinence, urinary dribbling, or hesitancy can predispose to infections and so on. So once again, it is not the chronic kidney disease itself that is giving rise to the incontinence. But in this situation, it is the enlarged prostate which is causing kidney damage that is also causing the urinary incontinence.
Thank you, Dr. Baite. Talking about prostate, I think even though we've not even finished with part 1 of our health awareness, I've already had a couple of suggestions about prostate and the effect of enlarged prostate as a topic for the next discussion that we have. So okay. I think we'll put it on the calendar and we'll talk about it next time. And this goes to Akatakyie Patrick Osei. That's the topic that he suggested that we talk about. So we'll do that next month, hopefully.
It's a very important problem that is very, very common, in particular in African-American men. Okay.
Right.
Common here, common in Ghana.
Yep. Thank you. So since I don't want to make Akatakyie Joseph J mad at me for playing Koko football, I'm gonna go ahead and talk about or bring up his question. So he said, because of COVID-19, people are being encouraged to take vitamin C and D, etc. And how much of these vitamins are too much as far as kidneys are concerned?
The high level, the high potential content.
What vitamin C and D?
Vitamin C and D, yeah.
I don't know where the advice in terms of COVID as far as these vitamins are concerned. Okay. I'm not aware of any study that says that if you take vitamins, you are not going to get COVID-19, or if you take vitamins, if you get COVID-19, you are not going to get severe forms of COVID-19. There is no respectable study anywhere that shows any benefit from these vitamins as far as COVID-19 is concerned. COVID-19, you wear your face mask, social distancing, hand sanitizing, and so on. Avoid crowds here and there. Okay, that is all that as far as COVID-19 is concerned. But again, I'm not aware of any study that has any linkage with that. And in terms of chronic kidney disease, taking vitamin supplements, themselves are not going to help you. Okay, but if you have developed chronic kidney disease, we know that there are certain types of vitamins that you become deficient in as a result of a chronic kidney disease. And these are vitamins that your doctor will arrange to have you to receive, in particular vitamin D or other substances that can help raise the level of your vitamin D can be connected with that. Okay. But again, in general, vitamins are not going to help prevent chronic kidney disease. But if you have developed them, then specific time. Again, you want to talk to your doctor. Don't go ahead and buy over-the-counter medications here and there. There are some specific types of multivitamins that doctors will recommend for you. But you don't want to go ahead and take things as the result of advice from friends or reading newspapers anywhere. Please discuss these things with your doctor.
Right, and I think I'll add to that. I'll add a little bit to that, and of course, Dr. Boite is very right in saying that there are no standardized studies that tell us that vitamin C is effective in COVID. That's definitely the case. But I think that's the reason why we even talking about vitamin C and other vitamins is that vitamin C has been, there is a lot of controversy around vitamin C, but the good thing about it is that it is a water-soluble vitamin. So it is not that, so it is a safe medication to take, okay? The water-soluble vitamins are safe to take, like vitamin B and vitamin C. Okay, so it's I am not going to say don't take vitamin C altogether because it's not too harmful, except when you take it in super high doses, when it starts to crystallize in your kidneys and forms all kinds of stones in there, okay? But having said that, why are people even talking about vitamin C? There's been anecdotal reports that very high doses certain kinds of
Potassium content
infection.
diets.
Mike, could you mute this?
Tony, Anthony, can you mute your phone, please? The girl, can you mute them?
Potassium content diets.
There are some centers that are using very high doses of vitamin C to treat certain severe infections. Okay. We don't have any good outcome studies on that, but that is in question. So should we use vitamin C for COVID? No, we don't have any standardized studies on that, but am I using vitamin C? It's an interesting thing. I have always used vitamin C to treat certain viral infections, especially I'm somebody who develops herpes around the mouth when I become sick. Okay, so if I know that I'm going to develop it, I take high dose of vitamin C, like 2 grams a day, and those fever blisters will not show up. It is just like that. So, but this is not something I can recommend because I have not done any studies on that, and I have not written any papers on that. So I am not going to recommend it. Let me give you a story. My brother in Saudi Arabia, he's also a physician there. He's an infectious disease doctor. And when they developed this MERS syndrome, the MERS outbreak, he was admitted to the ICU. And whilst he was there, he took mega doses of vitamin C and survived. 3 or 4 other patients were there with him. They all died. Okay, so they were kind of surprised that he survived, even though he had the virus in his blood and all that. Could we attribute it to the vitamin C? No, we cannot say that. It is too anecdotal. So that's how medicine works. We hear these kind of stories here and there, but it is not something that we can standardize for the general public to use because we haven't done enough studies to ascertain whether they work or not. So if you've heard about people using vitamin C, maybe people have had experience about it and they are using it. Is it harmful to use? Probably not, unless you use it in super high doses. So that's all I can say about it.
Thank you, Dr. George. That was very insightful. So I'll go back to Akatakyie William Blagoji again. He has another question. He wants to know if one can live a normal life with stage 2 kidney disease. And also he wants to know how does one manage a stage 2 kidney disease?
Okay. Stage 2 kidney disease is a fairly early form of kidney disease, and most likely you'll have no symptoms. You'll not even feel that there's any problem. Okay. What I mean by you will not feel that you have any problem is that you will not feel any different from someone who has no chronic kidney disease, stage 2, and you'll be fine, move on with your life. But the important thing is that you don't want the stage 2 kidney disease to move on to stage 3 and then stage 4. So this is why you want to make sure that you address the factors that may be in you that may have led to you developing the stage 2 chronic kidney disease. Either high blood pressure, diabetes. These are the 2 important things that we talked about. Of course, other factors that we already mentioned, and avoiding medications that are likely to make your kidney function worse. Lifestyle modifications that we already talked about, exercises, and so on. Yeah. So you will not feel any different if you have stage 2 chronic kidney disease. If you're feeling different not because of the chronic kidney disease, but because of the underlying problem that you have. The caution that your doctors will take will be if you are going to be doing any particular tests, if you are going to be given a dye, the dye that they give, in particular if you're going to have a CAT scan sometimes they may want to take a look at your kidney function to find out whether it's appropriate to go ahead and give you and what type of diet they need to give to you, depending on how your kidney function is. Yes.
Okay, thank you much. The next question comes from Akatakyie Joe Jemfi. He wants to know the side effects of eating too much nuts and if it's related to kidney disease.
Nuts, COVID, you have anything about it?
No. Again, if you mention, you're talking about nuts. Let's take particular example. What nuts do we have? What's the commonest one that we have around? Peanuts?
Peanuts, yep.
That's fine. I mean, eating
this moderator seems to be doing some kind of a partiality thing over here.
Oh, no.
No, you are not asking the questions in order.
I'm sorry, Akatakyie. Your question is.
I'm going to ask you this question.
One second.
No, you're not doing your job.
I'm going to ask the question.
I'm going to go ahead and ask the question because you didn't.
Listen. I'm sorry.
No, you are not doing.
I'm going to ask the question.
And if you are not doing your work, we have to step in. Okay.
I understand that.
I have questions for you two guys. No, Mike, I'm not going to let you ask the question.
Let me finish.
You go ahead and ask. You go ahead and ask.
Okay, I'm going to ask.
Can you go ahead and ask?
Disease decrease your sex drive?
Say it again. Say it again.
He wants to know if chronic kidney disease will decrease your sex drive.
I know that. I knew it had to be something like that. I knew it. I
think the answer is
for him to jump in like this. I kind of knew it was going to be something.
And only Tony will ask such a question anyway. only Tony.
Listen. So it's when you get to end-stage kidney disease, it's been listed that about 80% of them have erectile dysfunction. Okay, but of course, it's not everybody that gets that. But about 80% of patients have erectile dysfunction, but that's with end-stage renal disease. 20% are fine. They can use sildenafil or any of these phosphodiesterase inhibitors, and they are going to be fine. Okay, so that's it. But when you develop like say stage 2, stage 3 disease, you are totally fine. You like your sex drive should not be impaired to any significant degree if your kidney function has not gone down the drain. Okay, it's when it goes down the drain, when it's not able to produce all these hormones, that's when you start getting problems. There is a particular hormone there's a particular hormone called prolactin. This prolactin is typically excreted by the kidney. And when the kidney is not able to excrete it or get rid of it, it builds up in your body and it starts causing all kinds of sexual dysfunction. But that's when your kidney function has gone way down, like you are around stage 5. That's when you start experiencing all this. So
hey, George, you don't know how many people are here to hear you saying all this.
I mean, if you want to bring a new discussion to this, that's fine. But as it relates to kidney problems,
let me add this, George.
Sure, go ahead.
For those who are in the very, very early stages of chronic kidney disease, we are talking about stages 1, 2, or 3, those very early stages. If you are developing any sexual dysfunction, it's most likely not from the chronic kidney disease itself. It is from what has led to the chronic kidney disease. Yes. If it is because of diabetes, you've had diabetes for a long period of time, that has led to your early chronic kidney disease. The same diabetes can also give rise to the sexual dysfunction. Okay, so it is important for you to make sure that the underlying disease that is causing the kidney damage is properly addressed, because that disease can also give rise to sexual dysfunction.
Okay, thank you, Doc.
Both men and women, not just it's not just men.
Tony,
Tony, Akatakyie Tony, I'm glad you're happy now.
Oh,
Okay,
no,
so
believe me, so you have a whole bunch of guys out here, especially Frank and whole.
Well, Tony,
okay.
we can schedule another meeting in regards to that, right?
We'll do that.
I mean,
Yeah.
for sexuality, you know, we can discuss that.
We'll do that. Can we go ahead and because there are a lot of questions I need to bring up, if you don't mind.
Okay,
So,
Akatakyie, Mike, before you go forward, right? We've done 2 hours already. I'm good, but if anyone wants to leave, it's up to you.
I have a small contribution here.
Go ahead.
Go ahead.
Dr. George and Dr. Boyd, thank you very much. And the guy, I forgot his name, the one who volunteered to talk to us about his state renal disease. He's a hero here because for him to volunteer to give us that information, I mean,
Yes, absolutely.
It's not easy.
Yes.
And thank you very much. Doctors, the last question about erectile dysfunction and kidney disease, will it, if the underlying factor is diabetes, will it affect the erectile functioning? Because it's more to do with the blood flow to the organ.
Yeah, the way that diabetes causes chronic kidney damage, it's more in terms of the blood supply to the kidneys. The diabetes after a long period of time, in particular if it's not been properly controlled, it causes damage to blood vessels, and therefore the amount of blood that is going to the kidney tissues themselves becomes impaired. So you don't have enough blood going to the kidney. This is what causes the damage. Okay. Now, the same process is also going on inside the person's genital organs. Okay. The blood supplying to the genital organs are also being impaired by the same process of the uncontrolled diabetes. This is what gives rise to that. So that is why it's extremely important to make sure that all these factors that we're talking about that can cause damage to your kidneys are properly addressed. Because if they are not properly addressed, diabetes, for instance, then you could end up with the erectile dysfunction.
Okay, thank you, Dr. Boite. Okay, because of our time, I'll go ahead and ask these questions because there are a lot of them. So the next question comes from Akatakyie Kwatin Asari. He wants to know if it's normal for people to have low red cells.
To have low
red cell count.
Low red cell count.
Right.
You want me to take it? Okay, so red cells, the blood consists of a fluid portion and a cellular portion. What you see as the red coloration of blood is all made up of red cells, okay? It is this red cell that carries the oxygen to various parts of your body for you to function as a normal person. So I don't envisage a situation where your red cells are low and you'll be functioning properly. It also depends on how long it took. The symptoms that you feel when you have low red cells, we call it anemia. Okay? The symptoms that you feel depends on how long it took for your red cells to become low. If you decrease your red cells over a long period of time, it gives the body time to adjust to it. Okay? It gives the body time to adjust to it. When the red cell starts going down, 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 then of course, the body senses that it doesn't have much oxygen and it causes you to employ other mechanisms like your heart will start beating fast to try to circulate the little oxygen faster. So that is where we get a problem because with that thing continuing, it can cause your heart to become dysfunctional. So red cells, you cannot go without red cells for a long time without it causing problems to your other bodily structures. Okay, so that's
let me add just a quick summary. Low red blood cells, as George explained, that is abnormal. Okay, no one should have low red blood cells. Okay, so if you have low red blood cells, your doctor needs to get to the bottom of why your red blood cells are low. Okay, okay, your doctor needs to do studies. Okay, this could be because you have some colon problems such as colon cancer. You may be bleeding from there. It could be because you have some form of cancer. It could be because what is it, of a problem with your kidneys. So please get your doctor to do the appropriate test to find out why your red blood cell count is low, because it should not be no.
Can I come in here, please?
Yeah,
See, that thing applies to me. The first time I did blood work, they called me from my office to come and do, because I've been always having low red blood cell count.
Okay.
Now the symptoms that comes with it, I don't have it.
Okay.
So that was
how low? How low?
I don't know the numbers, but it's below the normal count.
The normal
so count. That is in the 90s. The first time when I was going to Ghana, and I said, okay, let me go and do physicals. So the first blood cell that I did, when I came back, there was a message on my phone that I have to come and do the test again. I did it, and it came out the same thing.
Okay.
And since then, I've been, anytime I do blood work, it's the same thing.
Okay.
All the symptoms that they said that you should experience, because I don't have them, and I'm strong. I'm not sick. I don't get sick.
It would have been very nice. It would have been very good for us to know the level of low blood count that you have for us to make a better assessment. Yeah. But it is always abnormal to have a low blood count. Period. And
I was going to suggest that, Dr. Bibi,
I am hoping that, sorry?
Dr. Bibi, I was going to say that because of our time, maybe we can take this offline. Yeah. So Akatakyie Kwatin will put you in touch with Dr. Bibi and Dr. Boite so that you can have an elaborate discussion with them. Okay. The next question comes from Akatakyie Patrick. He says that, can you elaborate on why the recently approved SGLT2 inhibitors are touted to be so effective in treating diabetes and renal dysfunction?
Okay. What we tend to see in medicine, that anytime there is a new group of medications tend to come into the market, the pharmaceutical companies, they are very good, because they are no more making money from the old drugs that they have produced. The patent is already gone. They are not making money. They want to make money from the new drugs that are coming out. So they will put out word. If you guys remember when Lipitor, for instance, came out about 20 years ago, okay, it was considered like a wonder drug. Now they don't talk about it as a wonder drug. There are newer ones that are presumed to be better than Lipitor. Okay, but some years back, this was supposed to be the good drug. So these new medications, that is the current talk now. But we know that the old drugs that have been there for the last, drugs such as metformin, which have been there for 5, 10, 20, 30 years. Metformin was available when I was in medical school in the 80s. Okay, it's so very effective. But because the pharmaceutical companies do not make much money from it, they are going to put all the money in terms of marketing these new drugs. Again, talk to your doctor about these medications. Don't just fall for the ploys by these pharmaceutical companies because they want you to use the newer drugs, which are more expensive, and they make more money from these new drugs than the old ones.
All right, thank you much. So Akatakyie John, I want to acknowledge you. He was the one who asked the cleansing question. So Akatakyie John Eshon, thank you for that. So he wants to follow that up with another question. He says there's a belief that regular intake of beets and Brussels sprouts are good for cleansing leftover waste in the kidneys. Is this a belief or simply a myth?
I think it's simply a myth. I don't have any studies to back that up. And like I've said before, there is nothing to cleanse. So we should just go away from the thinking that something is there for fluids to push it away. There is nothing like that, okay? So if you tell me that beads or whatever it is have any effect on cleansing, number one, I need to know what the word cleansing means. And yeah, I don't think there is any data supporting that assertion.
Okay.
Okay, thank you. The next question comes from Peter Siedo. Oh, Peter, yes, we are going to make the slides available.
You've been muted.
Am I muted? Mike, are you there? Is it me or him?
Yeah, Mike, I think he's having
Mike.
technical issues.
Mike,
I was able to see the questions.
Yeah, Michael, you're having a technical issue.
Hello.
Michael?
Hello. Okay, so do you have the host?
Yeah, I'm back now.
Do we see the questions? Okay, now you're back.
Oh, okay. For some reason, everything just disappeared and it's coming back.
Yeah.
Okay. Now I can't even see the questions.
Okay.
Akatakyie Digo, can you help me out?
Do you want me to make you the host again or something?
Please.
Okay, hold on. Let me see what I can do.
Okay. So while we're waiting for that, if you have any questions to ask, please, you can go ahead and have the mic to
yeah, okay. Can I ask a question, Doc?
Yeah, go ahead.
Oh, sure, go ahead.
Yeah. You were talking about the vitamin C and D. I have two questions. The vitamin C and D, you know, since the COVID came, everybody's talking about building your immune system to, I never used to take vitamin D, but now I've been taking it every day with vitamin C in addition to, because it builds your immune system to fight the COVID, and drinking Sobolo and all those crap. I'm telling you, if I don't drink, I bother my wife, eat the Sobolo for me, I drink. When I go out and come, you drink something with garlic and ginger because they build your immune system with zinc. I take zinc, vitamin C, vitamin D, and drink something with ginger and garlic.
Okay. My general approach is that what is it? All these vitamins, okay. If you are eating a balanced diet, okay, and when we talk a balanced diet, we saw the pyramid that George put up. Okay, if you are eating a balanced diet with a mix of fruits, mix of regular food, and so on, okay, you will get adequate amount of these vitamins. Okay, vitamin A, B, C, D, and so on. You're going to get adequate amounts from if you're eating a fairly balanced diet. And that is going to help you in terms of building your immune system. One very good way of building your immune system is get out there and exercise. Okay,
yes, which I do all the time.
You exercise, walk around, watch your weight. Those things will do much more, because people always want to go by the easy route, okay, instead of doing the hard work that pays off. Okay, taking a vitamin, a pill here and there gives you that good sense, okay? But the key thing that we know work, the ones that we know, time tested, watch your diet, exercise, okay? And do appropriate things. If you do all those things, they can help you fight COVID, okay? If you get COVID, if you get COVID and you have any of these morbidities, you're overweight, you're going to get a problem from that.
When it comes to
let us do the hard work. We talked about body fat. What is it? Abdominal fat. Work on your abdominal fat. What can you do about it to make sure you get it down? Does it mean you need to be doing sit-ups? Go ahead and get them down. Walk around, okay? That is the hard work that pays, okay? You go to a gym early in the morning, 5 a.m., 5:30 in the morning, you can see some of our white folks, they are there. You see them in your neighborhood, walking around, jogging around all the time. That is what pays off, okay? But some of us, we don't want to do that hard stuff that pays, okay? The vitamin, the pill is easy, just pop it. But please, let us do the hard work. The hard work pays off, okay? Yeah, it's not everything there that I do. Sometimes I'm not able to do it. I make sure I sit over there. Hey, I do about a few sit-ups here and there. You can do 10, 50, 20, 100 in a day. It's going to help up as far as your belly fat is concerned, okay?
Doc, I think the problem is, I don't know how to put it so that I don't offend anyone. But
it's okay. If you want to say it in Chi, you can also say it in Chi.
No. Most of the pharmaceuticals, I'm telling you, that has been the promotion. So people have, when I go to GNC, you don't even have vitamin C, because the idea is that it builds your immune. So, I mean, the people who are not in the health industry, we buy them.
Yeah.
So
I've been
this
on
is the thing.
I never used to take vitamin C because
this is the thing. When it comes to COVID, don't take your information from WhatsApp. Don't take your information from anywhere else. Go to the CDC website. That's where you will get the updated and current information on what to do. Because since it's a new disease, the information on it is such myriad that we get so confused and all that. So go to wear your mask, social distance, wash your hands, and go to the CDC website to get the necessary information that you need. Because this thing happened to even with the physician, a physician that handle these cases all the time. In the beginning phases of COVID, we were using zinc to treat patients. We were using a chloroquine, but as soon as the data came out and said that those things were not effective, we threw them away and adopted a new system of treatment. Okay, so you have to go to where the data is continually being updated to get your facts and not.
So can I stop taking the zinc?
No, stop. Well, it does not do anything as far as the COVID is concerned. We are no longer giving it in the hospitals. Even it was not every hospital that was giving it. Okay, so I am not going to advise you to take zinc. Even the vitamin C, I am not going to advise you to take vitamin C because the doses that you are taking it is not a dose that's going to prevent the disease. Okay. I don't want to advise you to be taking something on a humongous basis whilst we don't have the data to support it.
Okay. My last question.
Wear your mask.
Okay. Okay. We're going to take 10. So finish with that. Yes, go ahead.
Many years ago, my doctor told me to eat one banana for potassium.
Good.
So I try. I didn't used to like banana, but I do that. But I hear you saying decrease potassium. So where do we? I don't have kidney problem. I don't. No. At least I've not been diagnosed. So I know I don't. But I want to know if banana. I don't take too much because one banana has about 100 calories. So I will take only one. I will hardly take two. Is that okay to eat one banana or apple a day?
Yeah, that is good. Don't stop it. Continue taking it. Okay. We're talking about those who have chronic kidney disease, who are at the extreme end. Those people are not able to handle potassium properly. They are not able to handle phosphorus properly. So these are the people that they see a dietitian. The dietitian will give them appropriate advice in terms of what to eat and what to avoid. But for you, the average person who has no chronic kidney disease or who has very early forms of chronic kidney disease, please go ahead with the fruits. Fruits are good, much, much better than anything else. Continue the fruits. Don't stop taking them. banana a day, an apple a day that we always talk about,
Yeah.
that practice still exists. Go ahead.
Thank you so much.
Thank
I think
you.
this is very helpful. They're
Okay, very
taking our money
great.
for nothing. Thanks.
Okay, all right, good. I see that Akatakyie Patrick Jose has his hands up. Patrick, can you go ahead and ask your question, please? Patrick, we can hear you. Maybe you're muted.
He muted himself, I think.
Okay, so while waiting for Patrick, anybody have a question to ask?
Yeah, Mike, very quickly, if I may.
Sure, sir.
So, I mean, since we are on fruits, I think you mentioned that grapes have processed sugar. I was kind of a little confused and taken aback by that. Can you explain that a little bit better? I thought all fruits were natural sugars and not processed.
Yeah, yes, and I understand where the confusion is. All fruits are, but you have to know we have something called refined sugars. You have something called refined sugars, and in what I think
somebody has a, can you mute yourself, please?
Yeah, Henry.
Oh, it's me?
Yeah.
Oh,
yeah,
okay.
Can you mute yourself, please?
Can you mute
Henry, just mute yourself.
Okay.
Refined sugar in whatever form that it is, right? It's a source of sugar to your body, okay? It is like, oh, people will say that I am not going to eat sugar, but they will add a lot of honey into their tea, okay? It is refined sugar that you are having, which is glucose, okay? Sugar contains, the sugar that we eat contains glucose. That's what you taste on your mouth as is sweet. Grapes also contain glucose. Honey also contains glucose. It is this glucose that you are trying not to eat so much of, okay? So even though it's a good thing to eat grapes, just a little amount of that is fine, okay? You don't have to eat so much of it. And I used to be guilty of that until I realized that, hey, this is something that's actually letting me gain weight, because the excess glucose is deposited into your body. Some chemical process happen and it is converted into fat. Okay, so glucose is something that you really would want to cut back on, no matter what form it comes in. Okay, so if you are eating, go ahead.
So drinking a lot of soda.
Drinking a lot of soda, yes, sure. If it tastes good, you have to be very careful about it.
Some people, when they are eating, instead of drinking water, they drink soda a bit.
Dr. Boite, can I add something here?
Oh, yeah, sure.
So I think maybe if you could also comment on the need, one of the important reasons for eating fruits is just to get the fiber out of it for which reduces the absorption of sugar and also helps with the bowel movement. So when it comes to grapes, the problem is that it has very high concentration of sugar, most likely glucose, which increases your blood glucose level, but it has a very little amount of fiber. So the benefit of eating fruit is not really,
it's not that much. Yeah,
it's not really achieved with eating grapes. So some fruits are really high in fiber, and they are most beneficial because they help with the bowel movement, and two, they decrease the absorption of sugar into your blood. So even though they may have high levels of sugar like fructose and glucose, because of the fiber, it balances it out, so you don't absorb a lot of it. But the most important benefit of fruit is the fiber, not so much of the sugar. And so sometimes when you have diabetes, eating too much fruit might actually be counterproductive because of the content of sugar in it. So that might explain why grapes might be not so much of a desire as a fruit, as opposed to something like apple or other fruit that have high content of fiber.
Okay.
Thank you.
The general rule is make sure that whatever you're eating is not in excess. So if you're eating fruits, just like our bishop mentioned, just a banana, one banana is fine. We're not talking about going to eat about 3 or 4 bananas at a sitting. Okay, just one is adequate because it provides you with a lot of vitamins that you require. Okay, plus the fresh fruit. And the amount of glucose that will be in there will not be in excess that is going to cause you any problems. Okay, so again, it all depends on the amount of fruit that you're eating. And you're right, there are some specific type of fruits which have what we call roughage. Okay, large amount. These are substances which are not absorbed into the body; they stay inside your gastrointestinal tract, and they help you to get a free bowel movement so you don't end up getting constipated and so on. So again, you need to have a fairly balanced diet. Don't forget about the pyramid that George put up, okay? In terms of what is at the bottom of the pyramid, and then as you go up to the top, the things that you need to include in your diet.
Okay. Thank you, Doc. I think this has been a very interesting time, and each one of us have enjoyed, being a part of this program. So we're going to do it again. I think there are some more questions coming in. Henry, do you have a question?
No, I'm okay.
Okay, great. Thank you so much for your participation, and thank you so much for
being
a model for us.
I saw a question about plantains and something.
Yes, and that's I lost it. So if you can, whoever asked the question can repeat that, I think that will be helpful to all of us.
I also saw a question on somebody was asking about vitamin D3. I saw that question on there. Yeah.
Okay, I lost everything in my chat. So if somebody can repeat that question, that will be helpful.
Is vitamin D3 necessary?
Okay, let me read it for you.
Question.
Okay, it says with high level of potassium in plantain and banana, should patients of chronic and acute disease avoid eating plantain fufu?
Again, the same advice that we get, the same thing that we already talked about. The plantain itself, okay, in particular green plantain, doesn't have that level of potassium in it, and it's more in terms of banana. Yellow banana. In terms of orange, okay. These are some of the fruits that tend to have very high levels of potassium. And just like what I said earlier, if you have early stage of kidney disease or you don't have any kidney disease, there's no problem eating any of these fruits in adequate amounts. But if you have chronic kidney disease, getting to the end stage, particularly if you're on dialysis, then you want to be very careful in terms of how much of these fruits that you eat. You need to have a discussion with your dialysis doctor or your kidney doctor in terms of these fruits, how much you can eat and how much you need to avoid, so as to make sure that your body is able to handle whatever it is subjected to.
Okay. It's 9:30 by my clock, and Doc, you have a comment?
Quick question about the vitamin D3 that you was talking about. My earlier presentation, I mentioned about some, the kidneys helping to strengthen our bones, okay? The kidney produces a certain substance, and that certain substance helps in helping us to, helping our vitamin D to work properly. Vitamin D is required for strengthening our bones, okay? And if the kidneys are damaged, then the role that the kidneys play in helping vitamin D to properly strengthen our bones lost. And so that is why sometimes patients who have chronic kidney disease, sometimes they may be given a substance, okay, that will help in terms of managing their bones, in terms of managing their vitamin D. But for the average person who has no chronic kidney disease or has early chronic kidney disease, there's no advantage in taking vitamin D unless your vitamin D level is low. Okay. There are blood tests that can be done to determine whether you have deficiency in vitamin D. If your doctor tells you your vitamin D level is normal, there's no benefit in going to take any extra vitamin D, unless, again, you have chronic kidney disease. And in that event, your dialysis or kidney doctor will be able to give you the appropriate advice.
And talking about vitamin D, there is something that I have to add. And just like that, a boy he said, you shouldn't take it if your levels are not within the abnormal range. But we also have to realize that we are at a place where our exposure to sunlight is very minimal. In the morning, you get up, you hop into your car, you go to work, you go into your building, and at the end of the day, you would have realized that you haven't had much exposure to the sunlight, which helps you produce this vitamin D. So I've been seeing a lot of cases of vitamin D deficiency. I've been seeing lots and lots of cases. The normal level, we usually want it to be around 35 and above. Like there was a time when I did the vitamin D level of a patient and it came back as normal, I'll be surprised. A lot of patients were within the low 20s. So it's something that we need to be thinking about. We need to get it checked very often. And if we need to go on replacements, we do that. If you don't have any kidney disease, it is the inactive form of vitamin D that you take, the vitamin D3, which I think somebody was going to ask about. But when you have kidney disease to the point where you require the active form, your doctor too is going to let you know about that. So the point I'm trying to make is that let's be more aware of our sunlight exposure, get our vitamin D levels checked, and take the necessary supplements if we have to.
Thank you. Thank you, Drs. Vaite and Dr. George Bakuboni. It's been a pleasure. I want to respect our time. It's 9:34 by my clock. So at this time, I'm going to bring our session to a close. I can't do that without asking our dear President, Akatakyie Frank Champon, to give us closing remarks. Thank you all for your attention. Akatakyie, over to you, President.
Before the prayer, let me take this opportunity.
Oh, it's not a prayer yet. Okay, go ahead,
It's not a
Doctor.
prayer
yet. To thank Henry for being available and telling us about his situation, because this is what has helped us in terms of our preparation and then also in terms of this discussion. And we believe that the knowledge that he has let most of the people on this panel been exposed to is going to be of great benefit. And people will get to know that it's important to make sure that at least you do the appropriate things that we have talked about. Again, thanks so much, Henry. God bless you for what you've done.
Thank you, Dr.
You're
Vaite.
very welcome.
But we're going to come back again. Next month, we're going to do another topic. So
okay.
Don't go too far. I know how to find you, so I'll find you. Mr. President, over to you, sir.
Okay, yeah, thank you so much. I do appreciate it. First off, once again, thanks to Henry. All this started because Henry had posted something on the WhatsApp forum about how to save kidney, and he made a comment which I didn't understand. But then he sent me a message privately to tell me that he had hoped that he knew about all these things before. So in the conversation, I said, can we then maybe talk about this among us and engage other folks? And he readily said, oh, sure, why not? I mean, even if I save one person, it goes a long way. So, before I even say anything about the doctors and everything, so much thanks to Akatakyie Henry Esiam and for what he has done for us. And even looking at the number, right now, we still have about 41 people on there. That tells you the engagement, how interesting this topic to everybody. So I want to say that we appreciate you. And even for us to even open it up to national, initially it was only for DMV. And we thought, well, let's open it after we had some discussions among the executives. They said, why don't we also post it on the national? And I called him on the side, I said, do you mind? He said, oh, no. Somebody would never volunteer himself for that purpose, right? So Henry, once again, sincerely, I want to say thank you, thank you, thank you. I can't say thank you more than enough. Okay, we appreciate you and we appreciate what you have done. Now to the doctors, of course.
We're praying for you too, Henry.
Yeah, thank you. Yeah,
No
praying for
problem.
you. Yeah.
Thank you all so much.
Yeah. As for our doctors, I'm so glad that we have so many doctors within our, and it's so interesting. I called all of them, and it's like they were all interested. And in fact, one of them was even, I think, Papu Sapoe or somebody called. Oh, I'll do it. It's like the enthusiasm that tells you the spirit of being an Akatakyie. Like they all want to assist us because we are all brothers going up in school, back and forth. Nobody knew who was going to be what. And so thank you so much also for your time. We've been spending over 2.5 hours. In fact, they were even on around 6 o'clock. We didn't come on until 7, but so in all, they have been on here for over 3 hours, almost 4 hours now, just to get prepared for this, not to mention the presentation, everything that they did. So I want to say thank you. And based on all the interesting comments and everything that is going on, I know for sure that we'll be coming back to you all again in the near future for some interesting topics, one of them being prostate and the sexual dysfunction stuff, or the erectile dysfunction. So we will regroup, maybe we'll put something out, and based on interest of people, we are going to come back to you and ask that you come back again and help us out.
President, don't worry about it. I know where to find them. I'll get them next time.
Okay, yeah, thank you. And to the executives and everybody that helped, thank you so much for your constant, meeting, the background things that we have done that nobody knows is going on. And this is a good engagement that we have started, and hopefully it will be many more to come. And to everybody that attended this, I appreciate it, because that was what I was afraid of. In the past, what I've seen is when we do these kind of things, you don't get people to attend. But at least getting 50 people, over 50 at one point, or 50 something, that says a lot. And I appreciate all of you spending all your time. Of course, you are getting something, but even to be engaged in this and to participate, we appreciate you, the national folks, President, for your support in doing all this. Everybody, we appreciate all of you. And thank you so much. And we hope that the next time we'll do it. Of course, this is being done DMV. We are not saying that we are trying to maybe take over anything from national, but what we are doing is trying to educate people. So we will share with the national, and anybody that wants to, of course, attend, we'll ask you to attend. Okay, so we thank you so much. I can ask once again, I can't thank you more than enough.
And also we are planning to also put together a Christmas party.
Oh yeah, that was my next point. Let me, okay, so for the DMV folks, expect something will come out tomorrow about save the date. We have selected December 18th, which we are going to do a virtual Christmas party, right? And we are going to send details. We may need your addresses because we have some things that we want to send to you all in your houses before the Christmas party. So when you see those emails or those messages come out, yeah, asking you to please respond with your home addresses so we can send this to you. We want to make it an enjoyable Christmas party, virtual Christmas party. And the only way we can do that is for us to get you all to participate. So we need your addresses so we can send this out. So the executives are working on all of these things behind the scenes and will be coming out. But watch them out and we'll push them out. I'm not sure if any executive on here wants to add anything, but at the bottom line, thank you.
Also, we're trying
Tony, Tony in different ways helping out with the Zoom setup, say a whole lot. I don't want to go into names. Once you start calling names, then it's like, oh, why did you leave me out?
Right? You'll be in trouble.
Yeah, exactly. Yeah. So thank you all. We appreciate everything you are doing.
Quick one, because this is the age of pandemic. We cannot go without just spending just a minute, okay? Thanksgiving is coming next week, okay? And we all know about the current CDC advice in terms of this virus, which is getting out of control. It's going up. the figures that you see on television, this is real stuff, okay? We need to make sure that we follow the appropriate advice in terms of not traveling. That is what the recommendation of CDC is now. You don't want anyone flying around for this because of this virus going on. And then making sure that if you are celebrating Thanksgiving, you do it in the COVID way, okay? Avoid indoor gathering. If it's too cold outside, it means nothing takes place. You don't want to do any activity that will require you taking off face mask. Unless it's people, there are 4 of you in the house, that is fine. You already stay in the house, no one knows it's coming around. But if there is a student that is coming over to the house, another family member coming over to the house, you want to be extremely careful. Okay, so please let us listen to the current CDC advice. Dr. Fauci is almost all the time on television. Let us listen to the advice that he gives.
Thank you, Doc. Thank you, Mr. President.
Thank you.
Okay. Now I'm going to ask the bishop to give us a closing
before, I think Maile
sorry.
has something. Our secretary, I think, wants to say something.
Secretary.
Right? I just want to say, sir, you know, this has been phenomenal.
Very good.
You know, I am very thrilled. I'm very happy that, you know, you guys, I mean, it's all busy, but just to really do this for the betterment of our own health.
Okay. All right.
Seniors, you know, so and I'm hoping, say, as time goes down, we can do more of these things. So now it will help us in many various aspects of our lives. Yeah, and you know, that's all I can say. Thank you guys.
Thank you so much. Thank you so much. Okay.
Again, if any of the chapters want to do something like this, we'll always be ready to support them. So it's not going to be from DMV only. So if any chapter wants to hold something like this, they're all welcome.
All right. Thank you. Well, to respect our time, you know, I'm going to ask the bishop to give us a closing prayer. Bishop.
Okay.
Bishop, you're muted. Bishop. Okay, Mr. Secretary, can you give us a closing prayer?
Sure, I don't mind doing that.
Thanks.
All right. We want to thank you, God, for giving us this opportunity, for bringing everybody together. And this has been very fruitful information for all of us about our health. We just want to pray that everything that came out today, we'll be able to use it for the betterment of our own health. And that we can actually use that to actually help other people as we live our lives. We did want to say thank you so much and just help us be able to, whatever that we be to ourselves, but to be able to help our fellow citizens, our fellow Akatakyie, our fellow families, whatever it is, so that this will be something important. We ask this in the name that I pray. Amen.
Amen. Thank you. Right. You all have a good weekend.
Thank you very much.
Thank you, guys.
We'll meet again next month.
All right.
Yeah.
Thank you.
Thank you so much.
Yeah, Blackwood, thank you so much also. I forgot.
All right.
But, you know, and all the executives, thank you so much.
Thank you so much. Thank you so much.
No problem.
Yeah.
Bye-bye.
Yeah. Thank you. All right. Bye-bye.
Bibi, a quick question for you. Bibi, I have a quick question for you. How does the environment play any role in terms of our kidney functions?
Okay.
Yeah.
You can call him on the side and get that information.
Yeah. Yeah.
Yeah, Zoom party, you know, make sure that no get crashes.
Say, you send your command, phone. It's no.
Make sure say amount for aliens be abem.
Sir, aliens, I don't know.
Na say ayi chepo akwa no nyina say me hu agikum hine wo ho.
Say yes, the koto a national 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 you want to say or invite you almost. Oh, say we discussed it at the executive level. We felt say it was that important to also have other people to join tea.
So would you go now? Why your mood?
Yeah, so thank you. Yeah.
All the best comes from the West. All the best come from DMV.
Yeah, well, it wasn't that way. I wouldn't even look at it from that angle anyway. But
Henry,
it's all about Akatakyie, our welfare, and what we're doing for everybody. So that's the way I look at it.
Thank you so much, Henry. Why?
Yeah, Henry, thank you. Why are there? Trust me. Why are there? Thank you.
So,
yes,
yeah. Okay. You see, so we have so many as I said.
I go work up squad.
This is